The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Deb from URL Insurance Group, of course, and today is January 9th, 9:30. Happy New Year to everyone. Happy 2014. I was always taught never to start a presentation with an apology, but I feel the need to apologize for, quite frankly, the last 2 weeks. The December 26th webinar was canceled by me because I was not feeling well and didn't have accurate access to run the webinar from my home on the 26th. And then last week I was still sick, came in to do the webinar specifically because I didn't want to leave everyone hanging out there for 2 weeks in a row, and due to technical difficulties, no one could hear me. So I have to admit they were my technical difficulties as usual. So again, my apologies for that, but we are back on track for today, and we'll be here every Thursday at 9:30 as we have in the past. Just by a show of hands, if you could just click on the hand icon so that I can know if you hear me, I would appreciate it. I don't see any hands. Oh, there we go. Excellent. Okay, so everyone hears me. Thank you very much. So we'll get started. We have from October 1st through December 24th at midnight had a long haul, all of us, in trying to tackle healthcare.gov, trying to get the 2013 last-minute underwritten programs through, and just trying to adhere to the ever-moving goal line of the deadline for submission for 1/1. So it is obvious that the 1/1s now have closed. They, in the 11th hour, extended the enrollment for 1/1 effective dates till midnight on December 24th. So at this point, the 1/1s are all closed out. Obviously, the 2013 underwritten plans are closed out, and we're moving forward with the 2/1 effective dates. 2/1 effective dates close out on January 15th. So if your client wants a 2/1 effective date, then we need to have those applications for off exchange preferably by 1 o'clock on Wednesday the 15th here at URL. For healthcare.gov on-exchange applications, of course, healthcare.gov will be up and running until midnight, and the deadline for enrolling in a 2/1 effective date, or for a 2/1 effective date, will be able to take place on healthcare.gov. So that's what we're looking at. We've had tremendous numbers of submissions, and it can't go without saying thank you so much for submitting the business. I've always said your success is our success, and it certainly is the case with the number of submissions that we've had. So thank you all so much for submitting the business to URL. We certainly do appreciate it. I wanted to talk a little bit about some numbers. There was a report that came out that basically said close of business for 1/1 effective dates. It appears that about 2.1 million have made application. Now that doesn't necessarily mean that payment was made, but the closest estimate that HHS is giving everyone is 2.1 million people enrolled through the exchange. The other number is that 4.7 million lost their health coverage because their plans were being terminated. So, by any means of math, however you want to work it, that still results in a net loss of 2.6 million insured. So I'm not sure how successful the program is, but you can make your own decision on that. Some other numbers that we need to discuss is that there was a report that came out that basically said that all the healthcare.gov enrollments at the very beginning of the open enrollment, obviously we know that there were some issues, but the best estimate is about 10% of the people, to equate to about 15,000 enrollees that went to healthcare.gov in the beginning of the enrollment have not been able to, basically the apps were lost. So I would say that if you've not kept good records, that you want to go back and just keep some good records. If you've not heard from our case managers on those statuses, then I would suggest that you get a list together and get it over to us so we can verify, you know, if your insured really truly did have coverage. Now, I'm not sure what's going on. Kidding me? Where is this? I apologize. Once again, technical difficulties. I lost my box there. Okay, I'm back. So again, there are still some discrepancies in those people that actually thought they enrolled and those that really have enrolled. Another number that I want to talk to you about is the 90-day wait for new hires specific to group health insurance. We all know with the passage of the law that the law requires that employers cannot impose greater than a 90-day wait for new hires to be eligible to enroll on a group health plan, an existing group health plan. So just for your information, that 90 days is actually 90 calendar days. So if you are advising your group clients to you know, choose a new hire enrollment period, you may want to choose the first of the month following 60 days of full-time employment to avoid a mid-month effective date. So that's just a suggestion, but if you do have questions about that, certainly reach out to John Reel, our group health case manager and marketing representative, and he can walk you through the process for that and answer those questions. Another number that I want to bring to your attention is one that is very, very important, because as we move through 2014 and with the close of healthcare.gov on 3/31, as individuals and groups renew, there is you know, a strong suggestion out there and trend in the marketplace that suggests that about 50 to 100 million people will be losing group coverage, group health coverage in 2014. So that's a huge number, and to me that spells opportunity, and I definitely wanted you to be aware of that number so that you can start planning accordingly. Updates on children with the SSM. As we've been talking for weeks, the healthcare.gov system, if you have a parent or a husband, wife, and children up to 19, there are a couple issues, because in Pennsylvania, technically all children up to 19 are eligible for some level of CHIP coverage, whether it's subsidized or at cost. The healthcare.gov system is not properly recognizing the children up to 19. They're kicking them all out and basically saying you need to go to CHIP or to Medicaid for those children under 19. I have talked with Allison Bean, the policy director at the Pennsylvania Insurance Department, and have been in contact with NAHU, and it does appear that children of parents that make or are up to the 314% of the federal poverty level are eligible for some sort of subsidized CHIP. If your child, pardon me, if your client's children are eligible for subsidized CHIP or Medicaid, of course, they are not eligible to apply under their parent's plan. The parents cannot say, well, I don't want them on CHIP, just put them under my plan anyway, you know, even though I don't get a subsidy for them. That's not a possibility. The only workaround, if a parent doesn't want to put their child on the subsidized CHIP or Medicaid, is to back out of healthcare.gov, forego their advanced premium tax credit and enroll outside the exchange without a tax subsidy. That's the only option if parents want their children on their health plan. The real problem is that the system isn't backing down after above the 314% FPL. So again, that's a real issue, and at this point there's no workaround other than to make application for that child only, either in full cost chip or outside the marketplace into a child-only plan direct with the carrier. And of course, you know, you can assist your client in writing that application and receiving compensation. The other issue is the children up to 26, because most of them do file their own taxes. Healthcare.gov kicks them out, so I have no resolution on that at this point, but everybody is aware of it and they're working on the issue. We've had great success in Central PA with Highmark Blue Shield, and they are working through the vast amount of enrollments, and they came out with this information that is on your screen now and was in my Healthcare Essentials last week. But I wanted to just kind of draw your attention to a couple items. If your client's ID card was not received and they've enrolled in Highmark, once the application is processed and the first month's premium is being paid, your clients can access a virtual ID card online by going to this link, the link that Highmark put out. A real issue is if a member receives a bill for a payment that was already made, they mentioned that they're working through mapping all of the payments to the member accounts, but some bills generated before the payment was actually applied. So they're actually receiving bills as if they did not pay a premium. We can verify that the premium is received, and your client can pay the balance, or your client can just pay the full amount, and any overage would be applied towards the next month's premium, of course, the February premium. There's also some issues with members enrolled in an incorrect plan, and a lot of this came from the guaranteed issue plans that were essentially auto-enrolled into a new PPACA plan and possibly went on to healthcare.gov or outside of the exchange and enrolled in a different plan. And they are working through those issues, but the new app, whether it's via healthcare.gov or direct to the carrier through you and your assistance, that's going to take precedence above the auto-enrolled applications and plans. So again, just be patient. They're working through it. Hopefully they'll get everything up and running soon. But also keep in mind that payment for 1/1 effective dates to be received has been extended till January 15th. So we still have a little bit of time to work through all of this mess. So just want to let you know of those happenings. And one of the most important things is if you know, again, at the beginning and even now, if you're enrolling somebody on healthcare.gov and you did it over the phone and the health insurance marketplace worker refused to take your information, or the 834 reporting that the health insurance marketplace sends to the carriers dropped your information, every carrier is working on a workaround for you to claim those cases. So they are coming out with a process in order for you to claim those cases that you helped with, but we've not had any definitive information at this point on that process. I would suggest that all of you start gathering your records, getting your records together of who has made application, who you've assisted. We do have a sample BOR letter that you can utilize. A lot of you have printed the screen from the FFM or had your clients sign that Appendix C from the marketplace application. So again, all of that information just gather, because I do think that the carriers are going to be pretty good at working with all of us to have you claim those cases, meaning that you claim them as your clients and also claim that commission. So just keep that in mind. Next on the list is the EBICS update. I know that you guys are getting frustrated with how slow the carriers are being uploaded into the quoting portal, and trust me, I am frustrated as well. But I can tell you on the EBICS portal system for off exchange, not anything to do with our web broker contract, the following carriers are up and running: Aetna, Central Highmark, Western Highmark, of course United Healthcare. We don't offer them anyway, but they're on there. I did receive verification that Health America, Geisinger, and Capital should be up this week. They're currently in their testing phases, so hopefully that means that right around the corner they'll be up and running. Independence Blue Cross, I'm still waiting for verification on when we can expect those rates to be updated. But you can always go to our site for the carriers that have paper rates. They're going to be under our site, under Health Plan Options, under Product Information, and then the specific carrier. So you can pull those up at any time. While we're on the site, I wanted to draw your attention to our homepage, and any of our webinars, whether it's our weekly PPACA webinars or the Life Weekly webinars, they are all on our homepage under URL Upcoming Events. When you click on the webinar schedule, it's going to bring up every scheduled webinar, at least specifically for our PPACA updates. So you can go on and register ahead of time for all of these. Again, remember, if you register, you're going to get a recording, even if you can't attend. But you can, for instance, after today, when the recording is uploaded, when you click on January 9th webinar, you're going to be able to view the webinar and listen to the webinar even if you haven't registered. So just wanted to bring your attention to that. And for those of you that have not received notification, because of the huge amount of individual health business that's coming in, we have realigned our customer service team and case management team so that you can get through to people that you're going to get used to the service that, or you're going to have the service that you have been accustomed to in the past. So we now have 3 individual health case managers. Jessica Kyer is still, of course, an individual health case manager. She's going to be working with agents that have the last name starting with A through G. Judy Reed is, of course, still an individual health case manager, and she's going to be assisting agents with last names starting with P through Z. And we've added Elise Wilkinson, in that mix so that she can assist agents with last names beginning from H through O. Elise was the group health case manager. Many of you have worked with her, but prior to her becoming the group health case manager, she was actually an individual health case manager. So I do think you're in good hands with all 3 of the case managers, and they can certainly help you with any of the issues that you are having. So at this time, that brings us up to the end of our agenda, and we're going to open it up for questions. And I'm going to see what questions we have that were submitted. Hopefully not like last week where it says that we can't hear you. Margie says you'll have to repeat that information on CHIP and families on healthcare.gov when you can. Also info on the child-only app. Okay, so in Pennsylvania, children up to age 19 with parents up to 314, that's 314% of the FPL, qualify for some level of subsidized CHIP insurance. If they are eligible for subsidized CHIP, they are not eligible to apply with their parents on healthcare.gov. The real issue is the 315 to 400% that is being put into that mix. So the workaround is to make application off the exchange for a child-only application for your chosen carrier. Next question comes from Abby, and she says, could you say that statistic again for how many million people will be losing group health insurance in 2014? Abby, the estimate and everything that we're hearing is between 50 to 100 million. That's 50 to 100 million people losing group health coverage and now having to seek coverage in the individual market. And Nate asks where the BOR letter is located. It was in our newsletters, and I will make note to have Sarah add the BOR newsletter or into our newsletter that will be coming out this afternoon or tomorrow. Margie asks for updates on web broker contracts for on-exchange apps, and you know there are huge issues. There's one web broker that has been approved and went through CMS testing. All the multitudes of others, including ourselves and the carriers that have filed for web broker contracts, are still tied up in the testing. So it's a CMS HHS issue. I don't know what the ETA is on it. You would think that if one got through that the others would follow suit, including ourselves, rather quickly, but that doesn't seem to be the way it's panning out. So I don't have an ETA on when that's going to happen. I can just tell you that it is going to happen. John asks, for clients with a 2/1 effective date, is it safe for them to wait for an invoice for sending in payment right after enrolling? And my answer to that is no. I would always have them send in the application, the payment to their chosen carrier as soon as they get that congratulations screen on healthcare.gov. The payment functionality on healthcare.gov is still not working, so I don't want somebody to not get coverage because they're waiting for the carrier to process the application and send an invoice. So send in that payment ASAP as soon as enrollment is done. Another question is, can clients now work backward in healthcare.gov to get agents credited? If not, is there a workaround? And yes, to a certain extent, John, they can, and it's all going to really depend on what the carrier's rules are, but I would say get those BORs or any documentation so that we're ready to roll with the documentation that's required. Tracy is asking a question, and she's, just so everyone in northeastern PA or the northeastern United States knows, Tracy's sitting on the beach in Florida right now asking this question, but she's saying, have you asked or have you heard anything about the Blue Cross of Northeastern PA commissions? And no. I did verify on Friday with them that they absolutely will be paying commissions, but we have not yet received the details. We were supposed to receive those Friday, and there was some sort of glitch that they had to go back and rework the notice. So I'm anxiously awaiting for it as much as you are, but at this point we did verify and confirm that they are paying. We just don't know what it is. So have fun in Florida, Tracy. Don't worry about us in the sub-degree weather up here. Lori asks a question, what's the status of SHOP groups applying for tax credits? And Lori, the process is that you can go to healthcare.gov and get rates, SHOP rates. You can, of course, ask John Reel, our group case manager and marketing representative, for SHOP group rates. The tax credits are going to be applied if they're eligible, the small business tax credit, but there's a separate form, and that's really an IRS or an accounting functionality. So there is a form that the clients that enroll in a SHOP and want to claim the small business tax credit have to complete, but I would actually have them talk with their tax accountant for that information. We do have the form, and I will see if we can add that to either this week's healthcare reform newsletter or next week, and we'll get it out to you as well, Lori. Next question is, Sharon asks, can you explain again what is happening with a child between 20 and 26 on the exchange? Absolutely. A child between 19 and 26, or up to age 26, are eligible, as we know, to stay on their parents' plan until the time they turn 26, even if they don't live with their parents, even if they're married, even if they have an offering of group health coverage. The problem is with health.gov, the system is not recognizing them as dependents because they file their own taxes. So there's a real issue there, and I don't know what the workaround is, Sharon, but I can tell you that everybody's aware of it and is working on it. Tim asks, once a client has applications submitted to the marketplace and chooses a carrier, should we send client information to you? What is the turnaround time for commissions? And you can send that information to us, Tim. We would prefer it on an Excel spreadsheet. You know, the name of the insured, social security number, effective date, chosen plan, chosen carrier, and date submitted. It's not a requirement, but it will help. And the turnaround time for commissions, quite frankly, for 1/1 effective dates, those commissions are more than likely not going to be paid at best until the end of February, but more than likely in March, the end of March, because the carriers are allowing up to the 15th to make those payments, which is typically past the cutoff for the commissions. So I would anticipate some of them paying in Feb, but most of them paying in March. And Allison is asking, have you heard about Western Highmark commissions? Absolutely, Allison. I have that information, and I will send that to you. Western Highmark Blue Cross Blue Shield commissions they really differ based on if you're writing a broad network plan or a community blue plan. The community blue plans it's an 80-20 split, so they are paying $20. It's $20 total, so it's going to be $16 per member per month, and that caps at 5. And then for a broad network, it's $12 per member per month, and then it decreases year 2 and 3. But I will send that to you, Allison, so that you can review it. And it looks like that is all of the questions. There are some hands raised, and it looks like these were actually raised for quite some time. So I'm gonna unraise everybody's hand, and if you have a question that you want to talk to, right over the phone right now, just raise your hand again if you would. That way I can tell if it was an old hand raised or new. And it doesn't look like I have any hands raised. So we're going to bring this to an end. Next webinar is Thursday, the 16th at 9:30, our usual time. And once again, I really thank you for the business that you've submitted, and thank you for the success that you've given us, and hopefully you're reaping the benefits of that success for yourself. And Happy New Year, and I'll talk to you next Thursday. Thanks very much. Bye-bye.